Homocystinuria is a metabolic disorder. Look at this picture, shows the disease mechanism and signs and symptoms. Look at this detail going on. Introduction. Homocystinuria is a rare inherited metabolic disorder characterized by the accumulation of homocysteine, a sulfur containing amino acid in the blood and urine. This condition arises due to defects in enzymes involved in the metabolism of the amino acid methionine, which ultimately affect various systems in the body, leading to a wide range of clinical manifestations. Definition. Homocystinuria is defined as a metabolic disorder caused by defects in enzymes responsible for converting homocysteine to other essential molecules. This leads to elevated levels of homocysteine in the body, resulting in vascular, skeletal, and neurological issues, among other complications. Types. There are several types of homocystinuria classified based on the specific enzyme deficiency involved. 1. Classic homocystinuria type 1. This is the most common form caused by deficiency of the enzyme cysteine beta synthesis. CBS is responsible for converting homocysteine to cysteine, which is precursor of cysteine. To methyl terihydroborate reductase deficiency. MTHFR deficiency. Deficiency of this enzyme leads to elevated homocysteine levels and is associated with more variable clinical manifestations including cardiovascular and thrombotic events. 3. Cobalamin C deficiency, vitamin B12 deficiency. This type results from defects in enzymes involved in the vitamin B12 metabolism, leading to elevated homocysteine levels and neurological symptoms. For other rare enzyme deficiencies, including mutation in enzymes involved in the folate cycle, leading to a different pathophysiological mechanism of homocystinuria. Causes. Homocystinuria is caused by genetic mutation that impair the function of enzymes involved in the metabolism of homocysteine. The most common genetic mutation is in the CBS gene, leading to a deficiency of CBS enzyme. Other mutations include defects in enzymes involved in folate metabolism or vitamin B12 processing. The main causes include 1. Genetic mutation in CBS gene, 2. Deficiency in methylene tetrahydrofolate reductase, 3. Mutation affecting cobalamin B12 metabolism, vitamin B12 metabolism, 4. Enzyme defects in the folate cycle, 5. Autosomal recessive inheritance of metabolic defects. Risk factors. 1. Primary risk factor for homocystinuria is a genetic inheritance, specifically autosomal recessive inheritance. Both parents must carry the defective genes for a child to be affected. Additional risk factors include 1. Family history of homocystinuria, 2. Inherited metabolic disorders. Complications. The complications of homocystinuria can affect various systems in the body. 1. Cardiovascular. Increased risk of blood clots, stroke and heart attack due to hypercoagulability. 2. Skeletal osteoporosis, tall structure and scoliosis. 3. Neurological seizures, developmental delaying and psychiatric disorders. 4. Eye lens dislocation leading to vision impairment. 5. Cognitive intellectual disability or learning disabilities, especially in untreated individuals. Pathophysiology. The pathophysiology of homocystinuria is primarily due to the inability to metabolize homocysteine properly. When the CBS enzyme is deficient, homocysteine accumulates in the blood and tissues, leading to 1. Vascular damage. Elevated homocysteine increases the risk of blood clots, endothelial damage and atherosclerosis. 2. Skeletal abnormalities. Abnormal collagen synthesis due to imbalanced amino acid metabolism. 3. Neurocognitive impairment. Homocysteine affects the brain by promoting oxidative stress and damaging nerve cells. Below is the step-by-step explanation of the pathophysiology. 1. Normal methionine metabolism. Homocysteine has two main fats. 1. remethylation. 2. Transsulfuration. 2. Deficiency in CBS. 3. Toxic effects of homocysteine accumulation. Endothelial damage. Prothrombotic effects. Structural protein alteration. 4. Impaired remethylation pathway. Secondary effects. 5. Clinical manifestations. Vascular complications, skeletal abnormalities, ophthalmological features, neurological features. 6. Genetic basis. 7. Secondary effects on other pathways. Impaired transsulfuration reduces the cysteine levels, which may compromise the synthesis of important biomolecules. Example: glutathione, an antioxidant. The resulting biochemical imbalances underpin the clinical features of homocystinuria. Signs and symptoms. The clinical manifestations of homocystinuria vary widely but typically include: 1. Eye problems, ectopia lentis, leading to visual impairment. 2. Skeletal abnormalities, scoliosis, osteoporosis, and tall, slender body habitus. 3. Neurological symptoms, seizures, developmental delay, and cognitive impairment. 4. Cardiovascular issues, increased risk of thrombosis, strokes, and early coronary artery disease. 5. Psychiatric symptoms, behavioral changes, mood disorders, and psychiatric disturbances. Diagnosis. Diagnosis of homocystinuria involves: 1. Newborn screening, elevated levels of homocysteine or methionine in blood, often detected in newborns as part of routine screening. 2. Blood tests, measurement of plasma homocysteine and methionine levels. 3. Genetic testing, identifying mutations in the CBS gene or other relevant genes. 4. Urine test, elevated homocysteine levels in urine. 5. Biochemical test, measurement of enzymes activity in blood or skin fibroblast to confirm the specific enzyme deficiency. Nursing diagnosis. Nursing diagnosis for individuals with homocystinuria might include: 1. Risk for impaired vision related to ectopic lentis. 2. Impaired physical mobility related to skeletal deformities. 3. Risk for ineffective tissue perfusion related to thrombosis or clot formation. 4. Delayed development related to neurological impairment. 5. Deficient knowledge related to the management of the disorder. Medical management first. 1. Vitamin B6 supplements often used in individuals with CBS deficiency who respond to it. 2. Folic acid helps lower homocysteine levels by supporting folate metabolism. 3. Betaine increases the conversion of homocysteine to methionine, reducing homocysteine levels. 4. Dietary modifications. Low methionine diet to limit the precursor of homocysteine. 5. Thrombosis prevention. Anticoagulation therapy may be indicated in some patients. Nursing management. 1. Patient education, teaching families about dietary restrictions and the importance of vitamin supplementation. 2. Monitoring regular blood tests to maintain and monitor homocysteine and methionine levels. 3. Psychosocial support, providing support for cognitive and developmental challenges. 4. Medications administration, ensuring adherence to prescribed treatments. Treatment options. 1. Dietary management, a diet low in methionine and amino acid to prevent further buildup of homocysteine. 2. Pharmacological treatment. Pyridoxine, vitamin B6 for those with CBS deficiency who respond to B6 therapy. Betaine for patients who do not respond to B6. Folic acid and vitamin B12 to help reduce homocysteine levels. 3. Surgical interventions in severe cases of eye problems, example lens dislocation, surgical procedures may be necessary. 4. Psychosocial support, cognitive therapy or interventions for developmental delays. Psychosocial medicine. 1. Counseling to address emotional and psychological challenges. 2. Support groups, connecting with others affected by homocystinuria. 3. Educational workshops for patients and families to enhance understanding of the condition. 4. Stress management techniques like mindfulness and relaxation exercises. 5. Advocacy and empowerment, encouraging self-management and active participation in care. Prevention. 1. Genetic counseling for at-risk couples planning to conceive. 2. Prenatal screening to detect the disorder early in pregnancy. 3. Neonatal screening, early diagnosis through metabolic screening programs. 4. Lifestyle modifications, avoiding high protein diets in at risk individuals, 5 regular medical checkups for early detection of complications. In conclusion, homocystinuria is a complex metabolic disorder requiring a multidisciplinary approach to management. Early diagnosis, effective treatment strategies, and psychosocial support can significantly improve outcomes and enhance the quality of life for individuals with these conditions. Advances in genetic research and therapeutic interventions continue to offer hope for better disease management and potential prevention. Thank you. Have a nice day.